Good morning, my name's Dr. Jeremy McAnulty from New South Wales Health, and I'm here with a COVID update for Thursday the 2nd of December 2021. There were 271 cases of COVID reported in New South Wales in the 24 hours to 8 o'clock last night. The total number of confirmed cases of Omicron variant of concern remains at 6. There were more than 81,000 COVID tests in the reporting period to 8 o'clock last night. There are currently 144 COVID cases admitted to hospital, with 24 people in intensive care, 10 of whom require ventilation. In terms of vaccination across New South Wales, 94.6% of people aged 16 years and over have had one dose of vaccine, and 92.6% are fully vaccinated. Of the people aged 12 to 15, 81.3% have received their first dose of vaccine, and 76.8% are fully vaccinated. New South Wales Health's ongoing series surveillance program that detects fragments of the virus that causes COVID in series samples have tested positive in Woolgoolga, Murrurundi and Trangie, where there are no recent known cases. So everyone in these areas should watch out for symptoms, and if you get even the mildest of symptoms, please come forward for testing right away. The number of people with the Omicron variant of concern in New South Wales is 6. As announced yesterday, a fully vaccinated traveller who recently visited Southern Africa arrived on flight QR908 from Doha to Sydney on the 25th of November and tested positive to COVID yesterday. They are isolating in Sydney. Everyone on the flight has already been deemed a close contact and has been instructed to get tested immediately for COVID-19 and isolate for 14 days, regardless of their vaccine status. They can call New South Wales Health on 1800 943 553 for further advice. In line with Commonwealth measures, all travellers arriving in New South Wales who have been in Southern Africa, that's South Africa, Lesotho, Botswana, Zimbabwe, Mozambique, Namibia, Eswatini and Malawi during the 14-day period before their arrival in New South Wales must enter hotel quarantine for 14 days, irrespective of their vaccination status. All fully vaccinated travellers who have been in other overseas countries during the 14-day period before their arrival in New South Wales must travel directly to their place of residence or accommodation and isolate for 72 hours. They will only be able to exit isolation at the end of the 72-hour period if they receive a negative test result on a PCR test. These people must also complete a PCR test on day 6 after arrival. Any unvaccinated arrivals go directly into the 14-day mandatory hotel quarantine. It's critical that everyone who has already arrived in New South Wales and has been in any of those 8 African countries within the previous 14 days must immediately get tested and isolate for 14 days since they were there, and call New South Wales Health on that number, 1800 943 553. In this phase of the pandemic, all of us must take responsibility for keeping each other safe, and we strongly recommend wearing a mask when indoors where you can't physically distance. And we all have to be vigilant for symptoms and practice those COVID-safe behaviours of physically distancing, practicing really good hand hygiene, not going out if you've got any symptoms at all until you get a negative PCR test. So thanks very much everyone for coming forward to getting vaccinated, and don't forget to get your second dose if you haven't had it yet, and your booster dose if it's been 6 months since your second dose. Thanks very much.